Hi everybody, we are with Dr. Jerajani, who's been my mentor, and I sweetly call him my Dumbledore because he's helped me through therapy and get me to be this person whom I am in front of you. And it's been a wonderful and joyous journey, sir, to be with you, with Anatta. And we are taking few steps more further, as you know, along with you, to take it now to another level and make it Anatta retreat, where we would like to help people with certain mental issues, depression, anxiety, and OCD. So, under your guidance again, sir, we won't be leaving you. You have to keep striving with us all the time. I would like you to answer, sir, what is clinical depression versus presumed or perceived depression?
Depression in itself is a kind of mental illness which is, given by the international criteria and American ones, European ones, Asian ones, all kinds of criteria which are given, and it's labeled as the mental illness, which can be of any severity. It can be minor, it can be major depression, but it's a kind of illness where people lose interest in almost everything. Means a person who is a lively, laughing and cracking jokes, and it is possible that when he's depressed, he's just simply non-communicative, withdrawn. He would not talk to people. He doesn't want to go outside. These are the different symptoms. However, the second part of the question is very interesting, is a presumed phenomenon. So there is a difference between what we call sadness or, bad mood, or you don't want to do something like that. So that is the different. The severity index, it is very different. The presumed depression, as you rightly said, is when the person diagnoses himself that I'm depressed because I'm not in good mood. Take example, this whole pandemic which is going on, and there is a forced lockdown. I mean, people, obviously they are not happy, but they don't remain that way. However, this person who has been either surfing Google or is talking to the local doctors and saying that I'm not getting sleep, I don't feel like eating, I can't go out, and he will be put for a kind of label that he is depressed or he is anxious, or depending on who is making the diagnosis. Now, what happens, unfortunately, in the current medical circumstances, people love to give medicines and patients take to medicines. They love to take medicines. The point is that because he has been given a label of being depressed, he is also prescribed medication, something to sleep, something to cheer up, something, unfortunately or fortunately, whichever way you look at it, the pharma industry has got tablet for everything.
Yeah.
And there are people who keep popping the tablet. So this pseudo depression are those people who are suffering with the symptomatology which is very similar to, but in fact, it is not depression, because the diagnostic criteria states that if you lose interest and if you lose it for sufficiently long period of time, that means the duration. It has to be severe in terms of, see, you feel depressed, I feel depressed sometimes, and we come out of it. It's a matter of few minutes to maybe half a day, maybe a day at the most. And that is the time. It's a reaction to the circumstances, which I would not label it as an illness. It's a mood variation, which is normal for all people who do not get what they want. They feel unhappy or depressed, which is natural, human response. So the difference is that one is an illness and one is a self-diagnosed, misdiagnosed, reinforced by medical generations or consultants either way. And that is the category which I would put. This would be the difference.
Can you explain the alternate life therapy program that we would be
Okay. Uh, I always say that our program is from medication to meditation. So primary emphasis which we give is based on that the person learns a different kind of lifestyle by becoming aware to one's own self. So therefore, I am using my body calmness to understand mind better. So in the treatment procedure, depending on client, his or her severity and the nature of conflict that they are facing, the kind of meditation recommended is different. So therefore, there is not only one kind of meditation. It is not A, B, C, and D. It is A, B, C, D, E, F, G. There are number of options which are available, which very qualified and trained people help them to conduct this. It's almost 2-3 times in a day that they sit for meditation. This is one aspect. The second aspect is to understand that where is the conflict. It is failure to identify that conflict is kind of eased by different ways in which the counseling is done. You know, Anatta retreat is not a kind of structured program that you get up at 5 o'clock, sleep at 10 o'clock. We don't do that. The fact remains that when person is in a reasonably good mood, when he is seeing people around him who are also laughing, smiling, enjoying life in very simplistic pleasures, small pleasures, sitting with a cup of tea and chatting with somebody, and they realize that I'm missing out on this. And that's where the counseling begins, by way of sharing. So there is one-to-one counseling, there is group interactions, there are sports activity, and people go for dinner and have a chat and things like that. It's a very unstructured but meaningful program wherein people learn some kind of sports activity, of course, after a certain period of time. Like example, going out for gymnasium, of course, somebody is always accompanying the person, but going for a swimming pool or a place where they are safe, somebody is always there to support and help them simultaneously to face the reality. And that is the great part of this treatment. We are not being judgmental. We are there supportive, conducive environment, not critical, not judgmental. And everybody needs a break. And well, trust me, if I am taking a break and simultaneously learning to overcome the adversities of inability to control the circumstances, well, it's a good therapeutic model which we have decided.